Welcome, everyone. Thank you for joining us for today's webinar. My name is Alex Key, Business Office Specialist with NCHA Strategic Partners. Today, we are presenting the NCHA Strategic Partners New Partner Showcase. A few logistic items before we get started. If you have questions, feel free to type them in the chat function located on your toolbar. I or Irene Watts will bring them up during the presentation. If not, there will also be a time for questions at the end. This meeting is being recorded to share with our membership. And without further ado, I will turn it over to the moderator for today's webinar, Irene Watts, Senior Director of Sales and Marketing, NCHA Strategic Partners.
Good morning, everyone. Thank you for attending, and also thank you to those who are watching this at a later date. To get us started, I want to provide an overview of who Strategic Partners is, so that you understand that NCHA Strategic Partners is a solutions arm of NCHA. We vet business partners that we market to all of our providers in North Carolina. These business partners go through a stringent vetting process, and they are partners that we know that our members need their goods or resources. Today, we're going to introduce you to 3 of our new business partners. We're excited about their offerings and how they can support our members. Today, you're going to meet Community Wellness, EHR Concepts, and Savaro. Before we get started with some questions that we have for each of them, we're going to have them each introduce themselves, introduce their company, and provide a brief overview. To start us off is going to be Community Wellness. Tracy Quillin is here with us with Community Wellness. Tracy, will you provide us an overview?
Sure, absolutely. Thank you for including us. We're excited to be a partner with your organization. As Irene said, I'm Tracy Quillin. I am the Vice President of Healthcare Partnerships for Community Wellness. And we are a company that was founded and created with the goal of providing an encompassing support system around senior patients with chronic conditions. We didn't want to just provide remote patient monitoring. We wanted to be able to provide a support system that not only helps with staffing issues, helps reduce readmission rates, help reduce those unnecessary or avoidable ER visits by supporting a patient from every aspect of their care from the comfort of their own home. So we provide numerous FDA-approved Bluetooth devices. Every patient that is prescribed our platform is also paired with a clinical wellness coach. So every patient will be assigned a local clinical wellness coach that is either an LPN, an RN, a PA, or a nurse practitioner that will work with that patient one-on-one. We will take the care plans that are prescribed by our clinical partner and just really help enforce compliance with their patients, be able to help with health literacy, really help educate the patients around their chronic conditions and the steps that they can take ownership of to be able to just drive the quality of their own life and their own health care. We have a big initiative around access to care and being able to provide our solution to every patient, regardless of geography or ethnicity, financial ability, just to be able to help provide every patient with an equal opportunity to be able to live a better, healthier life because of the access that we're able to provide them. We literally are an extension of our clinical partners' care teams. We white label our product so that everything that the patient sees is going to be a face or a logo or a color scheme of our clinical partner. And we just want to try to help extend the clinical bandwidth for hospitals and health systems and providers that are really stretched thin to be able to not only take care of their patients while they're inside the walls of their entity. We want to be able to provide them resources to help drive the quality of their patients' lives outside of the entities of their health systems or provider bases. We do not have any upfront costs to our platform whatsoever, and we do not charge our clinical partners for anything that cannot be billed and reimbursed through Medicare. So our program is legitimately a no-risk solution that really drives improved patient outcomes. So as I said, we're thrilled to be a partner of the NCHA and are really excited to begin to expand in North Carolina, not only investing in jobs and infrastructure, but investing in a better quality and healthier patient population.
Thanks, Tracy. We'll come back with some questions here in a few minutes.
Great.
Next, we're going to meet April Reed and Kim Holland with EHR Concepts. April or Kim, would you like to provide us an overview of EHR Concepts?
Yes, thank you so much for having us. And Tracy, it was so great to hear about your company and the services that you offer. My name is April Reed. I'm CEO and founder of EHR Concepts. And what we want to be known for is making health IT easier. In this complicated IT technology world, we've noticed that there's a lot of burnout and turnover inside the organizations. We've been around for 14 years. I founded the company 14 years ago, and we've had the pleasure of working in 41 states thus far. We do have a large office in North Carolina, so thank you, North Carolina Health Association, by bringing us in to represent the Carolinas and, the southern eastern border of the US. We've broken this down into three things that we do really, really well. One is help desk services. The second is offering professional services. And the third is about our Healthcare Institute. And so let's start with the help desk services. On the left-hand side, you'll see our services that we offer. We realized that when we were working inside organizations, patients were on long hold times when they would call in. They tried to get into their patient portal and they couldn't. We noticed that providers or the nurses needed assistance and they would call the IT help desk in the organization and couldn't get answers right away. So we set up our own help desk service to where we can be an extension of the healthcare organization, and we act alongside them and partner with them, and we are patient facing. We do offer 24/7 support. We offer tier 1 through tier 3 services. And then, of course, we're monitoring our reports and our trend analysis to make sure that we are exceeding the client's expectation in how many seconds we're answering the call. And lastly, everybody that works and supports our help desk is US based. And we believe that that, is important at this point in time. The results from our help desk is, in fact, that 98% of calls are able to be answered within 20 seconds. As you can imagine, that reduces the frustration for not only the end users inside the organization that need assistance, but also for the patients. We do have a 98% resolution metric, meaning we're able to hit answering those calls and or making sure that we get those solutions inside the organization. We're able to hit these metrics because we have so many relationships with EHR companies such as Allscripts and Cerner. So we can be that liaison that goes right to the client and be able to push over the resolution. 95% of our calls have a resolution rate the first time. Why? Because we have hired the best in the industry. We focus on hiring subject matter experts that know these EHRs and know what it's like to be inside an organization. And the last result is 65% is more cost effective than a full-time employee. And we are able to help many organizations simultaneously. And so it does, in fact, create a high ROI for these clients when they choose to let us help in their help desk services. The second aspect is professional services. We are a full managed service company specializing in the electronic health record, thus our name, EHR Concepts. We have offered optimization and training, configuration services, and full implementation. As I've mentioned, we've been around for 14 years. So when President Obama mandated that everybody go paperless, we were right there on the front lines helping with the full implementation. And along the way, offering training support, and then customization in order to create provider and end user satisfaction. The results that we've seen across the country is we have in fact improved patient safety. We've taken in mind where the risks are within the configuration or getting access or the lack of training. And so we have proven results and statistics that show that. We've been able to improve workflow efficiency and end user adoption through our services, because everyone that we hire comes from either a clinical background, a healthcare IT background, or an actual hospital background. You'll get to know Kim during Q&A, but she even comes from inside the organization, because we like to find the best of the best and bring them to our team so that we can, kind of stay up there in our support services and in providing the best, being true to who we are. Improved patient safety, and then of course, improved revenue, which then leads me over into our institute. One of my passions is training. It seems like training always seems to be the last thing that happens within organizations, when really it should be the first. And when the hospitals or the healthcare organizations were first getting an electronic health record and or new technology, they go through a tiny aspect of training. And then that's it. And so we've been able to come in and revolutionize the way that we're offering training services. We even have an entire institute that we're building custom content. We do offer 24/7 on-demand e-learning. If we work with an organization, we customize that curriculum according to the organization. So then the end users can log in themselves, they can go through their own customized learning journey, and then we can offer additional solutions on top of that, versus taking time out of their day, sitting in a classroom, for 4 to 8 hours, they're able to do on-demand learning. We do create learning paths, specialty specific. We've seen along the way how frustrated the providers that, let's say it's the neurosurgeons or the cardiologists or the dermatologists or the surgeons, say this EHR isn't specialty specific. And really an EHR can be specialty specific if we create those customized learning paths for them, which we have. We've taken adult learning methodologies in how do people learn versus just putting them in a class and or assuming the way they learn. We've actually incorporated it into our institute and our learning paths and our journeys. And then of course, we're running active user reports. You can even gamify it to a standpoint where people can come on and you can make the learning path fun and creative, and they earn points the better they do, and encouraging them to learn. The results have been super powerful in offering the 3 services that we've offered. Of course, we could offer so many more, but we have found that between training and help desk and professional services, from a package perspective, we are able to see massive results, improved efficiency, improved employee productivity, improved employee retention, and improved employee engagement. And we pride ourselves on this because we genuinely want to make health IT easier. And we've seen the burnout and the fatigue and the frustration of IT just piling on top of each other over the last 10 years. And so the services that we want to offer are, in fact, how do we make it easier? How do we create a return on the investment? And how do we get the client to say, oh, where have you been, all these years? So that's just high level about who we are. Again, thank you, NCHA, for offering us that strategic partnership. It's an honor, and we look forward to serving your clients.
Thank you so much, April. That was really great to learn a little bit more and provide that information to our members. Next, I would like to introduce you to Brandon Robinson with Savaro. Brandon, can you provide us an overview of Savaro?
Yeah, happy to. Thank you so much, Irene and April. Awesome to learn a little bit more about EHR concepts. So my name is Brandon Robinson. I'm the Chief Growth Officer for Savaro, live down here in Wilmington, North Carolina. And I've been in the telehealth space for about 12 years now. My role is to help hospitals figure out how to operationalize and commercialize TeleStroke and teleneurology services. A little bit about Savaro. We are a full service TeleStroke and teleneurology service provider. And the reason why we're so passionate about what we do is because if you look at the folks who are suffering from stroke, specifically in North Carolina, there's a big gap in between folks who can get access to care because of where they live compared to other folks across the state. Stroke is the 5th leading cause of death in North Carolina. Some other statistics that you might find interesting: every 40 seconds, somebody in the US has a stroke. Every 4 minutes, somebody dies of a stroke in the US. 80% of strokes are actually preventable. And every minute that there is a disruption in blood flow to the brain, about 1.9 million neurons are dying in the brain. So the faster that we can get access to care for these patients, the faster that we can treat them, obviously the outcomes are going to be better, and we're going to reduce the risk of death and long-term disability for these patients. Specifically about Savaro, we have basically built our approach based on what has been lacking in the TeleStroke teleneurology service model. So our Chief Medical Officer, Dr. Raj Narula, trained at one of the premier TeleStroke universities in the country, also ran a hub and spoke TeleStroke model out of Cooper University. And while he was building that model, he realized there were some key things that were missing as you look to the marketplace to try to purchase technology, to try to purchase services from TeleStroke vendors. And so that's really what we built our process and our approach off of. If you look at those, I will basically segregate them into 3 different aspects of our organization, as you can see on your screen. The first on the left side there is full TeleStroke and teleneurology. So we only focus on the neuro aspect of healthcare. That gives us the ability to dive deep into that discipline and to provide best practices to help hospitals become world-class providers of neurological care. Specifically, what we do is we build small pods of vascular neurologists. So we don't use, general neurologists or other neurologists who might have a specialty outside of stroke. We're focusing directly on vascular neurologists, and we're putting them in small pods. And the reason why this is important is because as you start to communicate and share information with providers that are outside your organization via telehealth, you want to be able to know that when you call, you're going to know that physician on the other end of the line. Working in small pods allows us to do that. Working with vascular neurologists only allows us to recruit neurologists from some of the largest institutions across the country that solely focus on stroke, so that when they get that hard to treat case or that difficult case that shows up in the hospital, they know what to do because they've trained at Duke, they've trained at Mass General, they've trained at Northwestern. We also focus on the experience of the hospital staff and what it's like for them to access a vascular neurologist. So typically you'll find that telehealth organizations such as Savaro or other providers of telehealth, they will use call centers. They will use some type of go-between on the person who picks up the phone at the hospital as they're trying to reach the physician on the other side. They'll typically put in some type of consult request form, or they'll call a call center. And as we were going about building our organization, we realized that that's not the best thing for the person on the other end. When you're in a chaotic environment, such as an emergency department, and there's a stroke patient in front of you, you want to be able to speak to a vascular neurologist immediately. So we developed Savaro One Call. That gives us the ability to connect the physician that is on call, privileged member of that medical staff, licensed in North Carolina. We give them the ability to reach that individual within 45 seconds. So anybody in the hospital can dial one number, it'll automatically route to the vascular neurologist, and they can begin to talk and communicate about the patient immediately. So you're not leaving a message, you're not waiting for a call back, you can begin to treat right out of the gate. And the last thing that we provide is this opportunity to collect and analyze and then actually make decisions on data. So EHR concepts, I'm sure you all see this. A lot of times data is trapped in the EHR, right? You collect it, you put it in the EHR, somebody knows how to go gather it, but bringing it out and then analyzing it and looking at it from the manner of being able to make decisions upon what's happening is very difficult, especially in stroke programs. any of your hospitals in North Carolina that are accredited stroke program have to track data. They've got to communicate that information to get with the guidelines, the AHA, or communicate that to their accrediting bodies such as Joint Commission or the other bodies that are out there. And so what Savaro has done is built a proprietary software called Savaro Synapse. This allows us to pull about 55 points of data that are associated with stroke programs. And then anybody in the hospital can log into that, run a report, and see for the last week, the last month, the last year, the number of stroke codes that it came through, the number of those patients that have gotten access to thrombolytics, whether it be TPA or TNK. They can see exclusion, they can see criteria why that patient didn't get access to thrombolytics. All the data that hospitals are trying to gather, we capture that for them and deliver it back to them in a meaningful way so that they can make decisions. So as you look at this, kind of these three different instances of our organization, you're probably worrying about like the so what, right? What does this actually mean? And so what we find is that hospitals that work with us, whether they be a very small regional hospital or a comprehensive stroke center, any hospital along that continuum will be able to provide access to a vascular neurologist within 45 seconds, which typically leads to a higher utilization of TPA, which is the only FDA approved medication for stroke. So the average across the country is about 10%. Savaro sits at 20%. So more patients are getting life-saving medication. That also comes with a higher reimbursement for the hospital. We also find we get reduced readmissions because we're able to treat that patient more appropriately, follow that patient into the inpatient setting, reduce the risk of that patient leaving without seeing a neurologist, and then finally improved revenue. So all of our hospitals, once we become a member of their staff and provide our services, they're able to get higher reimbursement for the vascular neurology and TeleStroke services that we provide. Thank you.
Thank you, Brendan. So as you can see, community wellness, EHR, and Savaro are all leaders in their areas of expertise. We are very proud to endorse each of them as one of our business partners. I also wanted to really remind you, each of them, everything that they offer affects patient care, which ultimately is what is important, is how are our patients being taken care of? How quickly are they being taken care of? You know, is everything being documented correctly? When they are discharged from the hospital, you know, what happens then? So this really helps with that whole continuum of care. Tracy, I do have a question for you. For community wellness, what differentiates you from your competitors? You know, we hear of remote patient monitoring. It's almost like a common word now that, you know, that people use. Explain what the difference is and what you guys offer that other companies that have remote patient monitoring don't offer.
Yeah, absolutely. Great question. So there's a few different things. Obviously, our clinical wellness coaching is a big differentiator for us. So we don't use a call center. The relationship that the patient forms with the coach that we pair them with, that's an ongoing relationship. Every interaction they have with their coach will be that same coach. So it really is relationship driven, which really drives the compliance and the consistency to compliance for patients to utilizing our platform. Another big differentiator is we actually provide clinical staffing on site for all of our partners for the implementation and onboarding. This again there's no upfront cost to our platform whatsoever. We understand that staffing is a huge issue for all of our clinical partners and all of our healthcare entities right now. Any reason that someone is prevented from starting to utilize our program. So we provide a nurse to work side by side with our healthcare partners to be able to help implement and deploy and onboard our platform into their program. We also have a medication adherence aspect to our platform that drives compliance to patients taking their prescribed medications as they are supposed to be taking them. For any of our healthcare partners that also have a 340B program, that's also very beneficial for that because we're able to help those patients utilize the pharmacies that are associated with our clinical partners. So there's several differentiators. Those are the big key ones. There's no upfront cost. There's basically no cost because we don't bill unless there's the ability to, in turn, for our clinical partners to bill and receive revenue. It is a revenue generating stream, and it just provides a better level of patient care while expanding the clinical bandwidth that our clinical partners are in desperate need of right now.
Yeah, that's very helpful. We know how difficult workforce is, with our hospitals right now. So any, support that we can provide there, and this would be a unique way to do that. April or Kim, can you explain to me, like why you decided to start or create EHR concepts?
Yeah, I'll take that. So I was in 2004, I was actually on the Department of Defense rollout of the electronic health record and rolled out the EHR globally, and really didn't know what an EHR was because it wasn't really a thing, believe it or not, back then. In 2004, 5, and 6, I was on this project. And then I ended up going to the commercial side and rolling out an electronic health record as well, and went from hospital to hospital to hospital. And as I went around, I actually saw the need to truly understand the application as well as understand who was getting that application, which was the clinical side of things. And I began to see these gaps and this frustration and this overwhelm. And then, as you guys know, I mean, it was just like everyone was thrown to the wolves and mass adoption and throwing out electronic health records left and right. And so I actually created an internal academy, and I recruited people from within the organization to teach them as much that I had learned and had known. And I had created a reputation across the country. And I hired people that cared, that actually wanted to teach and that had experience. And so, like I mentioned, Kim's one of them. I met Kim through one of our clients. And then I have the ability to get people to come. But what makes us so different and why I founded that company was to put those people in the field. And because I saw a need for what people really needed. And it wasn't just to throw in an application and to throw them to training and to assume that patients are going to be taken care of, when it was unfortunately creating quite the opposite. And creating, a mass, end user, I don't know, I wouldn't say adoption, I would almost call it like a hiatus. And so, yeah, that was why I created it. I had a passion to do it better and to genuinely help the healthcare organizations and then send people that cared as much as I did. It was kind of why I started.
Love it. Thank you, April. And while we're talking about EHR, Kim,
Yes.
can you, so previously being in a hospital, how would EHR make your position when you're in a hospital? How would it make it easier? What would that mean to the employees at the hospital? Just kind of explain that so that, maybe we understand the benefits on that level.
Right. So being in the health system, a hospital, or whether it was a multi-physician practice, EHR concepts, they're subject matter experts. So anytime that I was rolling out EHRs, always heard, especially after the fact, well, they didn't teach me that, or the system's not going to work for us. And with EHR concepts, you have subject matter experts that can come in and actually optimize the system for you. A lot of times health systems think that, we're just going to get rid of this EHR because it is not working for us, and we're going to go to this other EHR that's the top of the line. And honestly, if an EHR is not optimized, if the configuration is not set up correctly, then it really doesn't matter what EHR you're on. You're always going to continue to have the same issues. So with EHR concepts, I know I could use them. I know that they would find a subject matter expert to come in to one of my practices, work with my orthopedic physician, work with my cardiologist, work with my primary care, and help them know how to, one, decrease clicks, because that's the other thing. Physicians are like, I got to click 50 times and it's costing me money, and and everything. So I knew that I could contact EHR Concepts and they would come in and help me. And from just the ROI on that, the physicians were happier, the clinicians were happier, and honestly the C-levels were happy, because now the physicians were not fussing because of the EHR, and productivity was going up.
Perfect. I know for me, a lot of times when you're training on something, it really is not until you're using it by yourself.
Yeah.
You go, wait a minute, I don't remember how to do this. So
Yes,
it makes total
exactly.
sense. Absolutely.
Yeah.
So Brandon, I know you touched on it just a little bit, but provide an overview again, or just explain the types of neurological services, and then what makes you different from other like telehealth providers.
Yeah, good question. So, a lot of times we focus on stroke because it's the issue that's acute and the people see right in front of their face, right? But there's a lot of other neurological needs that happen within the emergency department or within an inpatient setting. So, typically when I'm speaking to a new hospital or someone we haven't worked with before, we're looking at providing all acute or non-acute neurological services for the hospital, right? That could be anything from a patient seizing in the emergency department to a stroke in the ED, right? Or you might have a patient who goes to the floor for a neurological disorder, and now they're in the ICU or in a medical unit of some sort, and the hospital doesn't have access to that level of neurological expertise that they need. And so in any of those settings, we can introduce our technologies. Obviously, televideo is now a commodity. We've all used it. We've all been, we've all been patients who have used it. We've all been providers who have used it. And so that's really not, what I'm here to promote, right? That's not something that differentiates us over other organizations, but it's the ability to provide that expert neurological care, whether it be acute or non-acute, for a hospital setting. And we even work with hospitals in outpatient. They're building outpatient neurological programs, and they can't recruit enough neurologists to their town, and so they'll look to us to provide that as well. And then one other thing that I will talk about is, a lot of times hospitals and health systems don't realize that once you look at telehealth, whatever discipline you're talking about, for us, obviously it's neurology, but once you focus on a specific discipline in telehealth and you bring that into your health system, you really don't have to recruit for that level of provider anymore, because everything that you want to do, you're now able to open the door to be able to use telemedicine to either maximize what you're offering, to fill in the gaps that you're offering. So it's not uncommon for us to go to a hospital where they have 1-2 neurologists who are doing everything, right? They're coming to the ED for strokes, they're rounding on the floor, they're doing outpatient. Once we get there, they're like, oh my gosh, thank you so much, because now I have a life. I don't have to be on call 24/7, right? You guys can take the acute neurological stroke, needs in the ED. I don't have to go down there anymore. I can focus on the inpatient rounding and the outpatient, which is what the hospital actually recruited me for, right? So one of the differentiators for us over some of the other programs out there is we will come in and build a program that optimizes your current neurological resources, but also build it from scratch for you, right? So that's one thing that's differentiates us from our competitors. And the last two things I would say is, it's really about bringing in the right level of expertise, whether that be the physician or the technology, right? And so for us, again, you've heard me talk about vascular neurology. If you're going to provide stroke care, I won't say that general neurologists or neurologists out there, or even ED physicians, don't have the ability to provide that service. But if you can get access to a vascular neurologist who has had specific training in stroke, that's probably the best level of care that you're going to be able to achieve. And so with telemedicine, you can bring that level of expertise to any hospital in North Carolina, whether it be small, medium, or large. And then that technology, the Savaro one-call solution really is a game changer in telehealth. I was just actually in Reno, Nevada last week, speaking to a hospital. They're rolling out our services. Everybody was shocked at how easy it is. You just pick the phone up, you dial one number, you're speaking to a vascular neurologist. We say within 45 seconds, but really it's in with 15, 20 seconds. That is unheard of in telehealth. It usually takes somebody putting in a form, somebody calling a call center. You're trying to figure out when that person's going to be available to call you back. The ED physician has now moved on to another patient, right? You can imagine all of the inefficiencies in those types of process. And so the one call really is a big game changer in telehealth.
So you mentioned them, like if a hospital or a health system has an existing like neurology program, what if they already are using another telehealth provider for like teleneurology? How would that work? Just
Yeah.
another
So,
resource or?
yep. So I'm trying to think if we have any current customers that have, a different teleneurology practice during the day and then us overnight. One's not coming to mind, but I do know of some that use their own teleneurology services. So they optimize their current neurologists with telemedicine so that they can provide, services across the continuum without having to be there in person. And so what it is there is looking at, okay, what's the level of care that you currently provide and what gaps do you have? So the instance that I'm thinking of is, they might have their own teleneurologist during the day, but overnights they need additional coverage. They don't have enough neurologists to cover overnight. Our system is built that we can integrate into any EHR that is used, right? I didn't really touch on this, but we can log into EHR remotely and view those. We can view any images necessary. And we can also utilize any current televideo technology that they're using. So whether they are currently using Zoom with another teleneurology practice during the day and they want access to us overnight, they don't have to purchase any additional software, any additional technologies. We can augment those services as a plug and play.
And there's no concern with reimbursement with physicians being outside of the state?
So there is not. Any hospital that's interested, I can show you information and data to back up these claims, but basically with telemedicine in the state of North Carolina, you're able to bill as long as that physician is licensed in the state of North Carolina. And then because of COVID, there are a couple of other instances in telehealth specifically that you're able to provide services that allow for reimbursement. Those are on a kind of a case by case and discipline by discipline options there. We can get more into that with anybody who's interested, but there is not a distinction for reimbursement based off of where that physician is located, other than they have to be licensed in the state of North Carolina.
Okay. And Brandon, how long, if you connect with a hospital and they decide that they want Savaro's services, how long is that implementation process? How long does that normally take?
Yeah, it's a great question. I will tell you that any hospitals that are listening to this, typically this is what happens. You have a gap in your neurology coverage and you try to recruit, right, for that physician. And you think you have somebody that's interested, they cancel on you for some reason, and then you're stuck, right? Now you have a gap in your coverage. And so then you typically look to telehealth and they want to start immediately. So Irene, this is a great question. So typically a rollout for telehealth is going to take anywhere from 60 to 90, sometimes 120 days. It really just depends on the number of physicians that you're going to bring into that organization,
Okay.
what that hospital's ability to privilege and credential those physicians as members of their medical staff. What resources does that hospital have to do that? And then what technologies are we connecting, right? Do you need to purchase carts? Do you need to bring in televideo technology, right? Do you need to build an EHR interface of some sort? So typically, most of our rollouts are 90 days from the time you sign a contract until we go live, but it can be longer if it's a hospital system that has a number of hospitals and they've all got their own credentialing process. You've got to go through medical executive committee reviews and things like that as well. So it can be a little bit arduous and cumbersome. So we say typically 90 days.
Okay, that's helpful. Tracy, for community wellness, I imagine as you're talking, how does this work for the patient? Who actually helps provide? Because we know a lot of times with that patient, it's really like their caregiver that you're actually, having to provide, an orientation or training with, or if they have some other, it could be a family member, it could be, a hired caregiver. So kind of explain that process and what that would be like from, just engaging to actually using your services.
Yeah, absolutely. So there's a few different ways that we typically engage with the patients. So on our discharge platform, so if we're enrolling patients as they're discharged from either the ED or the hospital, we do have the ability to provide equipment directly to our health system or hospital partner so that they can actually onboard the patient directly from the facility and discharge them to home. Once they're home, our nurse will engage with that patient within 4 hours of that patient being discharged so that we can make sure that they don't have any questions about the platform, that they understand how to take their vital signs and what type of interaction that they're going to have with the coaches going forward. From the clinic setting for clinics that are owned by hospitals or health systems, or for independent practices, we're able to work with the physicians to get orders for patients that they're wanting to enroll on our platform. Once we get that order, our devices are drop shipped directly to the patients. They usually receive them within about 24 hours. And then we can work with either a patient's caregiver, family member, or even directly with the patient to get those devices set up. So the way that our platform was constructed was for ease of use. So we do make it very simple for the devices to be paired with a phone or a tablet. If we need to provide a tablet, if they don't have any type of device, we absolutely can do that as well. But we can do a telehealth visit to really walk through with a patient exactly how to set up their devices once they're paired. Literally, the only thing that they have to do is to be able to just take their vitals, and then the information is automatically sent to our system and then on into our partners EMR. So simplicity of use was something that was really important to us. I mean, we have patients on our platform that are 90 plus years old, and they consistently say that it is really easy to use the way that it was structured. Our coaches are trained to really meet the patients exactly where they are, to be able to walk them through step by step. To understand how to use the platform so it isn't scary. We've learned over the last couple of years that even our senior population is really very capable of using technology, because we were all kind of forced into it. My 90-year-old grandfather discovered FaceTime and thinks it's the best thing ever at this point. He doesn't ever just call me. He has to see my face now. So it's really interesting how we've learned over the last couple of years that they're much more capable than we've given them credit for. And we just provide them every resource to make this something that they're excited about using, which is why we have such a high retention rate of our patients on the platform, is just because we make it something simple for them. And we really help them see the value in them taking ownership and investing in their own healthcare.
That's fantastic. Thank you. Thanks, Tracy. April and Kim, I'm not sure if we kind of reviewed this before, but which IT platforms, do you support? And then also, when it comes to implementation, you have a couple levels of service. So when it comes to help desk, and then the institute, but then also if you engage in your professional services, kind of explain what that implementation process looks like, and training for internal staff, or how that engagement works.
April, you want me to take that?
Sure.
Sure. Okay. So as far as EHRs, basically any. So Allscripts is really our sweet spot. Allscripts is where we started. Actually, Allscripts is, I was implementing Allscripts. That's how I met April. She came up and she actually trained me on Allscripts implementation. So, but Allscripts, we do Cerner. I had my last implementation was Cerner through a health system. And we do Epic. We've actually helped a large system with Epic. We also, which we don't really touch on this a lot, but we also, if a health system is looking at switching from one EHR to another, we'll actually go in and do the work for you to compare which EHR is going to be most beneficial to the organization. So we do that as well. We Athena Care. Let's see. Who I'm missing a lot? eClinical Works,
Greenway, Meditech. Yeah, we're deep and wide.
It's really any EHR, because we have subject matter experts in all the EHRs. Mm-hmm. As far as implementation goes, when we go in to do an implementation or even an optimization, so let's just say that the health system has they already have their EHR. and it's just not working efficiently. The physicians are just very, very unhappy with it. They're trying to decide, do we switch to another EHR? Do we stay with this one? What do we do? So we will come in and we'll actually do a discovery. We'll look at, your note. We'll look at your configurations. We'll look how your users were trained. We'll look at just anything that actually pertains to the EHR. We had a organization that we did an optimization on, and they were on Allscripts TouchWorks. They come to find out they had tasks back to 2014 that had never been touched. And it really is, bottom line, it's on training and configuration. The tasks were not going to the right bucket. So of course the end users did not know that they were out there. So we went in and we did a discovery, and we focused on how is your note set up? How is your charges? How is your billing? How is the system configured? And went in and did basically shoulder to shoulder. We worked with the physicians, we worked with the clinicians, and we went in and did a whole learning perspective. We configured the system, and then after that, we trained them on how to use the system correctly. And what we found, or what the outcome was, is that the patient outcomes and patient safety. So they were at risk with the tasking. I mean, can you imagine? There's tasks out there that have never been looked at, and so that liability for a health system is huge. So we went in and did the training, the optimization for the end users, and the physicians were much happier. Some of the comments that we got back from the physicians is, I would have known about EHR concepts 5 years ago, I would have paid you out of my pocket. I mean, so those are things that really makes us feel like we are doing a great job. And one thing for sure is EHR concept, that we are all healthcare IT professionals, and we are here to help the providers. That's one thing. I think we got into the healthcare industry. We may not be nurses and, or anything like that, but I really think that we're here to help those providers and help those clinicians because we feel their pain. We've been there, we've seen it. And so I love the company. I'm so proud to work for EHR Concepts, and I just think we have a lot to offer.
April and Kim, are your relationships with your hospitals or health systems, are those short-term or long-term? Yeah. What is that time frame normally?
Of course, it just depends on the need that the client has. If in fact they are going to rip and replace, as we call, and we go through a vendor selection process, that would have a duration of a project, to walking them through vendor selection and then navigating that would be a short term. If we are offering our training solution services and we actually create a relationship to create that on-demand customized training, those can be anywhere between 1 to 3 year contracts because it's everything from coming into the facility and keeping that continuation of training. So that would be a long-term relationship. If in fact it's a help desk, solution service to where it's just harder to find people that can get answering the tickets, that would be a long-term solution where we become an extension of them. And then of course, there's sometimes just short-term projects. If we do a gap analysis and identify some gaps, and maybe it's just configuration, that's not going to take longer than maybe 30 to 60 days to come in and configure, similar to what Kim said. If we see that everything just wasn't optimized specific to the specialties and or the end users, then we can configure it, set it out, roll it out, and that would be a short-term project. So again, depending on the need.
All right, great. I've been monitoring the chat box. I don't see any additional questions besides the last one that I just asked. If you do have a question, please feel free to put that in the chat box. But while we're waiting on those, I'm going to ask each of you just to provide, like the top 3 reasons why someone would want to use your services. I'm going to start that with Tracy. If you would like to provide that, just a quick, 3 benefits.
Yeah, absolutely. So obviously the additional clinical bandwidth to your healthcare entity is huge. Just being able to have that additional monitoring and support for your patients outside of the walls of your entity. The no cost, no risk, there's no upfront cost. It's fully reimbursable. So you're never going to be upside down on our platform. And then being able to just drive compliance to not only your care plans, but also to just preventative care, being able to drive the compliance and importance of just your annual wellness visits and your preventative care and testing that patients should be doing that has seen an even bigger drop off since COVID is another big benefit of what we do. And us just being a true extension of your health system, of your care team, to be able to provide that infrastructure to drive compliance, to drive success and value-based programs, to be that care resource for your team.
Thanks, Tracy. April, do you want to provide a last
Yeah,
piece of benefit?
I'll keep it simple. I think if you have an electronic health record, which we all do, and you want to improve employee retention, engagement, and productivity, then we are a solution that can do that very thing. So if that resonates at all, we'd love to set up a discovery call and be able to see how can we do that for your organization by, again, improving employee retention, engagement, and productivity, and make the healthcare IT easier for you and your organization.
Thank you, April. Brandon?
Yeah. So I always think when people ask me, what's the biggest benefit of our services, and I'll get to the three, but I always wonder when we look at your stroke programs or neurological programs, right? If we look at the data and it shows that your hospital can do better, one of the issues that I always try to enforce is, or try to get hospitals to think about is, what if that patient suffering from a stroke was a family member, right? What if that patient was your mother or your father? You would want them to get access to a vascular neurologist as fast as possible. And so for us, it's not uncommon for me to go to a hospital and ask, what is your average door to needle time, which is the amount of time it takes for them to administer thrombolytics to that patient from the time they walk into the hospital. And it can be anywhere from 45 minutes, it can be up to an hour and a half, and sometimes it can be much longer than that. And one of the biggest benefits of Savaro is that we can help hospitals drastically reduce that time frame. So it's not uncommon for our hospitals to have 15-minute, 16-minute, 17-minute door to needle times. When you're talking about that level of turnaround in relation to the outcome for that patient, it's huge. That means that patient may not have a long-term disability, right? That means that patient may not die. That means that patient might get to other levels of care within your organization much faster as well if you're a thrombectomy capable center. So it's implementing something that is going to serve that patient much more quickly than you might be able to on your own with your with your current resources. I would say the other two is really about reimbursement. So implementing something like TeleStroke and teleneurology, all of the services that we offer a hospital are going to be reimbursed at a much higher level than what we're going to charge that hospital. So if you think about providing TPA to a patient that has Medicare or Medicaid, that's typically going to be a couple of nights in the hospital with somewhere between $22,000 to $30,000 reimbursement for that stay. If that patient didn't get TPA, it's much different for them. And then finally, it's reducing readmissions for patients, as well as reducing physician burnout, right? So two separate ideas there, but it's about the reduction. You're able to bring a higher level of care to that patient, as well as a higher level of expertise to your current physicians, and they will appreciate that. You won't burn out your current neurologists, nor will your current providers of other disciplines not know what to do because they don't have the right level of expertise at their fingertips, which they could if you had telehealth.
Fantastic. I think we have one question that came in. Pam, can you share that for me?
Sure. Currently in healthcare, we hear a lot about health equity. And this question is for Tracy, Community Wellness. Can you tell us about how Community Wellness leverages remote patient monitoring to advance health equity?
Yeah, absolutely. That's one of our core missions within our organization is we know that there's a lot of times, a lot of different reasons that patients don't get the healthcare that they need. Some of it's just they don't have transportation to see their doctor as often as they need to. They don't have the funds to get their medications filled, but they're embarrassed to have that conversation with their physician directly. So us being able to provide services and solutions so that if a patient doesn't have means for transportation or is just frightened to leave the house, there's still a lot of specifically that senior population that still isn't super comfortable going out in public, but still need to be able to have access to care. We're able to be that resource for them. We build those relationships with those patients so that if there is issues with finances or if there's just things that they don't understand about their chronic condition, but don't want to sound like they're not educated, they build those relationships with our coaches as their personal nurse to be able to ask those questions and to be able for our nurses to invest in those patients, to be able to walk side by side with them, to support them and encourage them. Our nurses are trained in what's called motivational interviewing. So they know very specific ways through very specific training on how to engage those patients, how to make them feel comfortable and feel secure, to just really be able to provide them the tools to take ownership of their own healthcare versus relying on someone just to tell them this is what you need to do and you just need to do it because I told you to. We really empower patients no matter what their issue is, whether it's financial or educational or geographical. We just empower them to have the tools so that they're not left out of being able to drive a healthier lifestyle.
Thank you, Tracy. And I would like to thank Brandon, Kim, and April and Tracy for presenting to us and for us to be able to have the opportunity to introduce you to our providers and introduce you as a business partner. We are excited at the offerings that you have that can support our membership. And I'm going to turn the closing over to Alex.
Thank you, Irene, and thank you so much for being such an excellent moderator. Thank you to all the panelists, and thank you for everyone who attended today's webinar, and for those tuning in. If you have any questions, please contact Irene Watts or me. This concludes today's session. Thanks again for joining and have a great rest of the year.